In Hebrews 9:27, it says, "It's appointed unto men once to die, but after this the judgment." As you all know, I've had 2 cancers. Yeah, prostate cancer, diagnosed in 2013. I had it removed in 2014. 2015. Don't remember. 2015, January of 2015. The prostate cancer, the prostate was removed. The doctors thought that the prostate was entirely contained in the prostate, but apparently there was some that had reached the margins. So I still, after my surgery in 2015 in January, I continued to have a PSA reading. So as I was preparing for additional treatment for that, which would have been radiation in summer of 2015, I was diagnosed with the lymphoma. I went through the chemotherapy on the lymphoma, and that was from August of 2015 into January of 2016. In March of 2016, I went through radiation, what they call consolidative radiation, in my chest area to hopefully finalize whatever effects the chemo was going to have taken place on the lymphoma. I'm just giving a history of my cancers here. So, at the depths of my chemo, my PSA reading became almost 0. 0.01 was the PSA reading.
What is PSA?
PSA is prostate-specific antigens. It is a blood test that you start getting at age of 40 or 45 in your annual physical that tells if the prostate is under any distress. It could be infected or it could be cancerous. Mostly your PSA reading is an issue where it's comparative. So if you get a dramatic rise, it doesn't matter if it started at 5, but if it goes to 10, then they want to be taking a look at it. So my PSA reading, a normal PSA reading is for men is under 1. My PSA reading at the time of my cancer was a PSA of 5 or 7. And then there's severity scales called the Gleason scale, where that runs from 1 to 10 as well. My Gleason score was 7, which put it in the aggressive end of things. So without a prostate, you should have no prostate reading. At the depths of the chemo, my PSA was 0.01, which is almost non-existent, but then it just gradually drifted up. And the radiologist who had been taking care of my chest for lymphoma said you should really have your prostate bed irradiated to eliminate whatever cancer remains. We think that's where it is. We think if there's any remaining, it should be there. At Thanksgiving, I got a prostate reading, or a PSA reading of 0.2, which is dramatically higher than 0.1, which it had risen to but stabilized at, and then it went to 0.2. As you probably saw in the email, that gave rise to a bunch of concern because one of the markers for metastatic cancer is a doubling of your PSA score within less than a 6-month period. Metastatic cancer is when the original cancer has moved someplace else. So normally metastatic prostate cancer goes to your bones. That's the most common. Anyway, that's a background for the discussion that I wanted to have here regarding the idea of refusing treatments. At what point does a Christian, should a Christian, refuse a treatment? Is refusing treatment a suicide? Is refusing treatment reasonable? how does that come into play? And I wanted to just put that out there and talk about it. Because one of my considerations was, I'm not going to get the orthodox medical treatment at this point, which would be radiation in the prostate bed. Radiation brings with it a whole bunch of nasty side effects, long-lasting side effects. Radiation for prostate starts a proctitis, which is just think of it as a sunburn at a very sensitive spot. It sunburns your bladder, so it hurts when you make number one, it hurts when you make number two. But more than that, irradiation of the intensity that they normally do in a prostate situation it kind of ruins the flesh in the area that's being irradiated. So when or if you ever need surgery in that area again, they can't really do anything because it won't heal because that flesh has been irradiated. So those were the things that are running through my head about why avoid the radiation? Why didn't I just get irradiated a year and a half ago? Could have had that and then probably wouldn't have a PSA reading, but may have long-term effects down the road. How do we make those decisions about refusing treatment? Is refusing treatment testing God? Is it, I just want to throw it out and say, has anybody ever thought about these things before? I've been forced to think about these things, but with this recent go-round, I thought, well, let's hash it out. Let's talk about it. What do you think?
I want to address side effects, if I may. Yesterday, I saw a commercial because I was watching a football game yesterday. It was over some.
Wait, you weren't studying for a sermon?
This was after I studied for my sermon.
It's got a little more done for
Yeah, and next week's too.
And the horse he ran in.
Yeah, that's right. This was a new one for me. I mean, we've all seen those commercials where you're just like shocked. Here's a new drug for some problem, and you're like shocked at the side effects. Internal bleeding, whatever, right? Heart palpitations, right?
Suicidal thoughts.
This is a new one for me. I saw that yesterday. I've never seen it before. If you have thoughts of suicide, it's like, are you?
That's actually pretty common anymore.
Yeah.
Yeah, that's a lot.
That's a
Most of them.
standard.
That's a lot.
Serious business.
Serious,
Yeah.
I've never seen that before.
And more so in the ones that are designed to treat depression
Yeah.
than any other drug.
It can make it way worse.
Talk about
yeah.
defeating the purpose.
You've just got to be kidding me.
No.
A drug to fight depression, you might have thoughts of suicide?
Yeah, so talk to your doctor if you do. Yeah,
What's he gonna do?
yeah,
Write you
exactly.
another prescription.
Yeah.
Write you a different prescription.
Right, give you another.
Okay, okay, well, you know what, I'm late to the party. Sounds like everybody else has heard of this. I was
Yeah.
a shocker to me.
Well, you were studying when we were watching.
I think that's why.
We were studying while he was.
On that note, I know
Wow,
somebody,
I mean, I can't imagine taking anything that would give me thoughts of suicide.
yeah,
I can't imagine that.
yeah,
But I guess I haven't had some of the problems that people have. I don't know.
yeah. I know somebody who has ulcerative colitis. The medication that could be prescribed for that causes colitis-like symptoms as a side effect. True story. Well, why would I take that? How would I know if my symptoms were from colitis or from the drug? Sometimes it works. That was the answer.
Okay.
So,
Wow.
Yeah.
nonetheless,
Some of those warnings may just be a liability protection.
certainly it is.
Yeah.
But, yeah, I talked to a guy who's been helping me out at work, who's kind of a health kind of a guy. And he brought up an interesting point. All these mass murdering type things that are going on recently, He's like, you never hear it, but I wish they would release what kind of meds they were on.
That's a good point.
And oftentimes, starting with Columbine, I have followed that.
But
Starting with Columbine, almost all of those mass shootings, those people were on psychotropic drugs of some sort or another, antidepressants or otherwise, you know.
And they just don't release that information very easily.
So how do you find that out? You just gotta read the major
Just
local. Yeah.
read the whole story, read deep.
Except there's nothing on Vegas, but we're
There's
getting,
nothing to read about
It's the
Vegas.
gun's fault.
but we're getting off of your.
We
question.
certainly are.
That's what happens when you don't have someone that.
Ethical considerations of refusing treatment.
Well, that's a relevant topic around here, because you have the Amish community, and or the plain community, if you will, who occasionally will get themselves in trouble for refusing certain treatments,
Yeah.
so.
But I think that's not happening near as much. It's the fringe. It's only the fringe.
That does that, yeah. Even still, every time I see that, though, I'll tell you what my first thoughts are, maybe not legitimate, that anybody, I mean, even if you have a child who we would say clearly needs treatment, and they're refusing treatment, I still cannot countenance the state who stands by while they actually kill children
Yeah.
to have any kind of jurisdiction
And-
over a family member
And
at all.
I would just want to direct this a little bit. Today, what I'd like to talk about is the personal refusing of your
Okay.
own treatment and talking about advanced directives or living wills. And I was going to let it morph into the discussion about what are parents' responsibilities, and maybe try to do that next week.
Okay, let's drop it down to a level that everyone has probably felt. Flu shots.
Flu shots.
Let's start there,
All right, sure.
because, go ahead.
Well, I was just talking with my neighbor yesterday. She said her husband just got the flu shot, and now he's had the flu for the past 2 weeks, and then she got it from him, and then the rest of their household. And then right after he got the flu shot,
Had she gotten the flu shot as well?
and she did not. She did not. She didn't say she did.
Yeah.
As far as I know, she did not. I know.
Well, one of the factors on the flu shot thing is certain professions, certain nurses, certain hospitals, you nurses, you will get the flu shot. Well, I
Or-
don't want it. Well, if you
Don't
want to
come to
work
work.
here, yeah.
But I'm just saying, in that situation, what people are saying is if you don't do this, you could die, because flu kills people.
Flu does kill people, and we are,
So
Accustomed to that.
if we don't take the flu shot, then are we, if you want to really break it down to the nuts and bolts of it, are we taking a chance at committing suicide, as you are saying?
Well, suicide has a very active intention behind it. It is different to intentionally kill oneself versus accepting a risk of that possibility.
What
Yeah,
what
I agree.
we might call
Reasonable.
negligence.
And I agree
Maybe
with
not
that.
even negligence so far, but if you get into a car, you know you could get into an accident and die. If that happens, did you commit suicide?
You could say the same thing about a Navy SEAL or a Marine or an Army.
Sure, and you're playing with livelihoods, but you would never say that a soldier or a Marine who gets killed in combat necessarily committed suicide by doing so.
It wasn't their intention to go in and die,
Right.
at least.
Not normally, there are exceptions, and those would be considered suicide if understood that way. So I don't know that you can legitimately say not getting the flu shot is an attempt at suicide.
Right,
And then to also realize that you can get the flu by getting the flu shot. Well, now you have the catch-22 of you're committing suicide potentially if you do get the flu shot.
Yeah.
When we were in the hospital with Constance, I have the list of videos that you have to watch before you can get out, right? So the
You know you
one,
can just walk out anyway, right?
well, so the one was about the flu shot. So the woman who's pregnant and her mother are talking. This is, you know, and the one who's pregnant says, well, I don't know if I'm gonna get the flu shot. And then the mother says, well, don't you wanna do what's best for your baby? Gives the whole spiel. And the girl's like, okay, yeah, I do wanna get a flu shot. It's like so manipulative, like the whole way it was filmed.
Oh, yeah.
Was to make the audience feel like if you don't get the flu shot, like you're not doing what's best for your baby.
Well, I mean, you can take this right into vaccinations.
Yep.
All the other vaccinations. You know, Sid and Annie got fired from their pediatrician because they won't, the kids aren't all vaccinated. And the physicians won't treat kids who aren't vaccinated. Those are, again, we'll get into that when we talk about the stuff with the kids. But, okay.
I would definitely concur with intent. I mean, I think that has a huge,
Right.
and then, you know, thinking of my mother-in-law who died of cancer, took all of the, whatever, and right away it was pretty much, the diagnosis for her was, you have so
Grim.
many days, you know.
Yep.
And I
It
just
was
said,
brain cancer, right?
lung.
Lung.
Stage 4. After watching that scenario unfold, I decided if I'm diagnosed with stage 4 lung cancer, and my diagnosis was identical to hers, I would not be getting anything.
Was there given any hope of a cure?
No, I don't think so. I mean, she may have prolonged her life a few months. She died from diagnosis, it was 9 months-ish. But at the end of the day, the quality of life for those 9 months was just
Horrible.
horrible.
Right.
I'd rather had 2 months of decent and then, you know, I don't know. And the question is somewhat related. You know, you still have the very grim diagnosis, but is it okay to say no? And in my opinion, the kind of pain and stuff that she went through for those extra few months of lying around wouldn't have been worth it. If it was me, that's what I'd be doing.
Well, I mean, I think even fundamentally speaking, we're dealing with a question that wasn't even on the table, say, 50, certainly not 100 years ago. I mean,
True.
You didn't have an option. You got it, and you embraced what it was, and you accepted it, and you died.
Right, you had
I
maybe
mean,
palliative.
diabetes would kill you. I mean, what Caleb had, even in the 1940s, he would have died from. It was simply because the muscle at the bottom of his stomach was contracted and it would not open up. And they didn't even know how to treat that until, I believe it was the 1950s. And even then, what they would do is basically they would make this massive incision and they would just cut open everything to get to the bottom of the stomach and then snip it and sew it, like snip out that hardened section, sew it back together, and then hope you recovered well.
Hope for the best.
Now, I mean, we went in when he was 3 months old, they made a small incision, pulled the bottom of his stomach out of his body, made that incision, sewed it back together, and put it back in.
Right.
I mean, like, it wasn't even, it was something he would have died from 40
There's
years
a-
ago,
right.
50 years ago.
And so there's a situation where there is certainly a hope of a cure.
Sure.
And so you would refuse treatment in that. You're talking about a situation, Ryan, where your mother-in-law didn't have a hope of a cure.
Well, I guess my point with that, though, is that were people wrong for just accepting the diagnosis back in the day? Were they wrong for just simply like, now, are we
What
gonna?
was the hope?
But I guess that's the thing, though, is having a hope grounds to say, well, you must now do this?
That's the question.
You know what I mean?
That's the question that's in
And I'm
play
just
here.
saying, I
That's the
don't,
big,
I don't know that it really changes anything, because in both those situations, while you can say, are we testing God by not taking treatment, you can also ask, are you trusting God?
or are you
Yeah.
playing God? I've heard that.
There's
Yeah.
certainly that question.
There's an aspect in which it is appointed once for man to die and then the judgment.
Right.
That, I think, needs to play into it to some degree, because to fight death at every turn, no matter what, would be to defy God's word. I
Certainly
don't
a
think that,
refusal
I
to
don't think
embrace
there's
our
a.
humanity.
Yeah, I don't know that there is a hard and fast rule, but it's a matter of judgment. And that's gonna leave a pretty wide gray area.
Well, to Ryan's point, my grandfather had verbally communicated that he did not want to be resuscitated in a bad situation, but had never
Written it
actually
down.
written it down.
Yes.
And when it came down to it, I mean, family members basically said, no, keep him alive. And number one, his quality of life has been horrible ever since. Number two, he was furious. Why did you bring me back? Like, he was good with it. There was an embracing of the reality of this will come someday, and I'm good with the reality of it's gonna happen, and you can't stop it, so don't, you know. Yeah, I think it is a matter of, part of it is a matter of embracing our humanity. I think what's tough about this, though, is there's a lot, and we've talked about this, there's a lot of difference, too, in where you are in life.
Exactly.
I would get you saying, you know what, I'm not interested in this fight. I've fought it to a certain point, and I don't want to. There's a lot of things I still would really like, Lord willing, to experience and do with my family and my children.
Yep.
So I might exhaust a few more options, simply by nature of where I'm at in my life. And Lord willing, some things I'd really like to do and see. But I certainly would get somebody in a different situation of life going, I'm good, like I'm good.
It's not worth the fight at that point.
Right, and I think the question is, what's the gain on the other side? Like, if you talk about hope, we have to talk about then, what is the hope for? What is the hope to gain a few more months? Is the hope to have a much longer life? Is there things just, I don't know.
Right, how long is prolonged?
How long is long enough? What's the value?
And we don't know how often it happens when they diagnose you, you don't have 6 months, and you don't get the treatment, and you live for 10 years. That happens.
Certainly
My
happens.
grandfather was in that situation. He was given 6 months to live 4 different times,
Yeah,
all about 2 or 3 years apart.
right.
How long did you live in?
After the first time, I think he was alive for another 15 or 18 years. After the first time, he was given 6 months.
Wow.
And he didn't get treatment,
No.
no treatment.
No treatment.
See, that's something to consider too. I mean, my mother, you know, some of you know the story with her, you know, had 4 children. Doctor said, you got blood clots, no more children. You know, she had 5 more and lived to be 86. You know, so is this the same doctor telling you that you have to take this in order to live?
Yeah, as I was studying this out, one of the things that was talked about is that people just used to accept their doctor's decision, and now it's much more in our own hands with the advent of these right-to-die laws that allow for living wills. Advanced directives like your grandfather should have signed, but didn't. Are advanced directives a reasonable thing? Or are advanced directives and right-to-die laws on the path to right-to-kill laws? Are they on the path to, you no longer have utility, and we're not going to?
Well, you had that doctor years ago, Dr. Kevorkian.
Yes.
With
Assisted suicide is a whole nother ballgame.
I mean, but it's linked to
But your
right to.
question, is this the road?
That's- But that's already happening, it's not.
Well,
Well, assisted
He's
suicide's
not-
legal in
He
Oregon.
can't practice anymore, but.
But there's a
It had
functional
already happened.
question, and again, like we've talked about already, it's a matter of intent. There's one thing to accept what my situation is, it's another to say, I'm going to change my situation to be that of death.
Right.
There's a big difference between accepting, I've been diagnosed with this, and I accept this as it is. And another saying, you know what, tomorrow, I'm just gonna end that. Like, that is a fundamental difference, I think.
Well, suicide is a type of murder, and we're commanded to not murder.
Absolutely.
It's self-murder, yes.
What, just to stir the pot a little bit, let's just say somebody got a nasty cut on their arm or something like that. Now, what if they said, well, just gonna accept this cut, I'm gonna let it get infected, this is what happened, and refuse any type of treatment to stop any kind of infections or anything like that, which, you know, might end up losing your arm, infection might spread, and you might die from a simple cut.
You might,
I mean, people have died from simple cuts
From
in
splinters.
years past. Yeah, exactly.
Sure.
Yeah. I mean, it's like a small scale version of what we're talking about.
Oh, but where's the
it doesn't-
fault?
but the principle is still
Right,
there.
there's a reasonability that I think needs to play into this. But again, that leaves a very wide gray area.
Right.
Is it reasonable to treat a simple cut and prevent?
But the word reasonable just implies arbitrary
you have
standards in itself.
yes, you have a responsibility under God's law.
Right, I would say that as a father with young kids, if I get a cut that could get infected and kill me, then yes, I have a responsibility to take reasonable measures to treat it, and if I still die from it.
I would
then
agree,
that's
I would agree.
responsibility.
I'm just
I'll go even
throwing it out there,
further.
that's
I'll go
what.
even further to say, like, I've really been kind of sitting here recently going, you know what? I would agree with that statement. Do I not also have a reasonable responsibility to maybe not destroy my body with all the crap I eat? Because I do have a responsibility to my children. Like, is that reasonable? To say, you know what? I really don't necessarily live in a healthy way that is gonna benefit my children very much. Do I need to reexamine that? Is that reasonable?
I think there's an expectation, I think that there's a verse, Mark 2:17, Christ was talking, he said, they that are whole have no need of a physician, but those that are sick, they that are sick. So there's an expectation there that if you're sick, you would see a physician. And that you would take care of yourself. I think that answers the question that you're saying is, you know, something simple, or even not so simple.
Something that
go-
you know
you-
can have a remedy.
You go find out
Right.
if there's a remedy. You find out.
Man, this is such a mess though, because, okay, you need a physician. And so I'm sitting here saying, okay, what's a physician?
Here I am doctoring with a guy who a lot of Orthodox medical people would
Right.
say is just a quack.
He's a quack, right, right.
You know, he's got woo-woo medicine, you know, voodoo.
Yeah, and all they are, some of them are glorified salesmen for the drug companies with a certificate on the walls.
There you go. They are politically protected by the FDA.
Yeah,
They're politically promoted by the FDA, the AMA, as opposed to the other side.
Yeah.
Homeopaths, prior to the Flexner report in, 1920, or whenever that was, were the preferred doctors. They were the guys who got results. The chemical doctors were the quacks at that point. But
I just think, again, even when you talk about doctors, doesn't intent continually need to drive this conversation?
It does.
What's the intent of the doctor? Like let's throw a real wrench into it. Is the guy wrong? Okay, so somebody opens that door and throws a grenade in the middle of the room. Is somebody wrong for jumping on that? Is that suicide?
that's loving your neighbor.
Yeah.
But again, that's because the intent is to love and to protect, right?
right.
So like, once again, is it not driven, it has to be driven by what is the intent
Yep.
behind not only why I'm trying to prolong my life or not, or who I'm going to, what is their intent? Is the intent to make money and be part of the system, or is their intent truly to love the neighbor and seek the medical best of people? I just think intent has to drive
That's a
this.
tough one, how do you know?
Right,
You know
unless
what
you
the doctor-
personally know
how do
the
you know-
doctor.
Yeah,
Not a bad idea.
Okay, here's
Good to know.
here's an example of what you're talking about, and I'll ask for judgment here. When I was going through the chemo, I was on a cocktail of 4 different drugs. They call it ABVD, and I can't name all 4, but adriamycin, bleomycin, VD. Yeah, were the others.
stay away from that one.
Then Blastine, and I forget the last one. Anyway, yes, stay away from the VD. About halfway into, maybe almost halfway into the treatments, all of a sudden, was having a terrible time breathing. I had difficulty with my breathing. It was labored. There was no question about it. You saw it here one week as we were praying. And when I reported it to the doctor, boom, out came the B. The bleomycin came out immediately. He said, boy, I hate that stuff. We're just gonna stop that. That's what he said to his nurse assistant. Boy, I hate that stuff. Now, here's the deal. He would not have given me the B, never, if he didn't have to, as part of AMA protocol. The protocol treatment for my particular Hodgkin was A, B, B, B. And if he didn't treat with all four, he would have been liable to losing his license.
Right.
Now, as soon as the problems manifested with the bleomycin, boom, out it came. And he
Wow.
said, boy, I hate that.
Wow.
Now, is he treating me, or is the AMA treating me, or are the drug companies treating, who's treating me? He was obligated, under his medical liability insurance, to give me the ABVD.
That leads into a matter of qualification for a physician, like
It
Joel
does.
brought up.
It does.
Because when scripture was written, the state didn't license doctors like we have today,
Right?
but there were certainly people who were sent for medical training.
Yeah, that's right.
Luke is a great example of
yeah,
that.
he seems to be
Luke
pretty-
was a servant
pretty
who
darn good
was
physician.
sent. Yeah. good
Christ
physician.
talked about physicians, we just read that.
Exactly. So there is a matter of qualification. Who gets to decide that? The state has taken that. I don't think that's legitimate. But that's where personally knowing your doctor, knowing what their personal qualifications are, is why you trust Jeff so much.
It's also why I look into these things myself.
Right.
It's my own responsibility, my health.
Right. Well, and that goes back to the verse you read, that because there's an expectation that you do take care of yourself medically as best you can, there's a responsibility to do some level of research and have some level of understanding, again, to a reasonable point, and not that we all have to go out and get
Right.
an extensive medical training, but we need to be conversant with those who are extensively medically trained. But I think we need to have a different standard of what qualifies as a legitimate physician
But you gotta
versus
dig
going-
pretty deep though,
Right.
because
Mhm.
this doc wasn't gonna mention anything about, I hate that B stuff till it came up.
Right.
You know what I mean?
We got
Can't
problem
go into-
breathing, for Pete's sake. I mean,
Yeah.
come on now. We gotta breathe or we'll be dead in 4 minutes. And so you give them something that's, I mean, that's maddening.
Yeah.
But it was also expected. Before I began chemo treatments, I went through both a echocardiogram, where they would read before the treatments started, so they had a baseline to test against, and also went through a pulmonary function test, where you sit in the chamber, you breathe into a tube, and they test what is your lung capacity, what's your breathing capacity, how much oxygen do you exchange in carbon dioxide and those kinds of things, and at what strength can you exhale and inhale. And they measure all of those things before I started. And then, of course, I had this trouble, and they tried to put.
But even
that
then,
in.
what influence does a drug company have on that test itself?
Don't know, yeah. But
That's the other.
But they knew.
Extra mandate, because if the doc would have right up front said, I don't get B, he wouldn't be a doctor very long.
Right.
That's right.
It's messy.
So, here's a question.
I mean, an approved, you know, he,
This is something I thought about. What, and I don't know the answer. Does utility play any role in decisions? So, if I'm, let's say I'm, 95, and I do get better, what utility am I gonna be in the kingdom of God anymore? Whereas if I'm 6 and I get better, I've got a whole life ahead of me. Or maybe if the treatment is gonna pretty much incapacitate me for the rest of my life. Does that weigh into whether it doesn't? If it does, if that's true, then doesn't that affect how we think about, say, an infant that's, you know, they do the ultrasound and say this infant's never gonna be able to do anything beyond just stay alive, possibly, then if we take that line of reasoning, why don't we just get rid of or let it die?
Utilitarianism is a real problem.
Well, yeah, we're addressing two things, we're addressing sustaining life itself, and then whatever we deem the quality of life to be an acceptable quality.
Right. Well,
So it's,
this is leading us into the next part of the discussion I wanted to try to get into, which is advanced directives. You know, which is, instead of, now I'm incapacitated, right? And somebody else is gonna have to make these decisions for me, right? Suppose I blacked out and now I'm in a coma from my breathing, right? And now Beth has to make the decisions. If I have a living will, you know, what do you put into living wills? Don't take any extraordinary measures or heroic measures, keep me comfortable, do DNRs, those kinds of things. What do we think about that? Is that a legitimate thing to do? And it gets into questions of what does extraordinary and heroic mean? What does prolong mean? You know, these are, and then there's the utilitarianism of kind of underlying that question of why bring me back? If I'm in a coma, just when can we pull the plug? Those kinds of, is it utility that matters, or is it the life that matters?
If you believe that it's keep life going is an end in itself, no matter what, then you're going to just prolong a life as long as you can, regardless. But if you don't believe that, and then it seems like you're inherently using some sort of utilitarianism necessarily, because you're saying
What's quality?
what usefulness is this person going to be anymore? Because presumably, if you believe they're going to have tremendous usefulness, you're always going to keep them alive, right?
Yeah.
But is that question though, because I know that the extremes that we're using are your life at 95 or your child's life at 5 months. And the issue with that is, I think fundamentally, those are different in that, those are in different arenas. One is you making it a conscious decision about your life. The other is, what is your responsibility to the life that's been given you to
Given you
oversee?
charge, yeah.
I would submit that perhaps those are two separate arenas. So I'm not sure that those are comparable. I get what you're saying.
Yeah, I think
Don't
there's a common.
the
there's a common-
considerations have to be the same?
I don't
Yeah,
believe, because you have certain
if you're responsible for your
responsibilities.
parents at 95,
Well, hopefully you've had that conversation with them
right? And
about
if
that.
you have, but is it still right for them to say, no, this person doesn't have much utility left, they're 95? I'm gonna-
Right, I mean, that's a different
XYZ
scenario.
have
That
to
is a
do it.
different
If
scenario.
murder and
That's way more
suicide
troublesome.
have the same, if you think about those in the same way, then you have to think about those two situations the same, don't you?
Yes, but I think what Ryan's saying is, to me, a way more one-for-one argument than myself. Myself being old is, I should have a directive, this is what to do. A child is responsibility that I have to make a decision about this life. And I think Ryan's situation that he just threw out is way more one-for-one with that. If I'm now responsible for my parents' situation, and they're both in a car accident, and they're both in comas, now what do you do, especially if there's no directive?
Well,
That's a way stickier wicket.
yeah. Would it be that directives are more for medical establishment and those providing emergent care or longer-term care to give them guidance in the absence of family to help make that decision? Like, as a parent, I make the medical decisions for my children and direct the doctors in that course, under advice and all that sort of thing, but it's, because the children are my responsibility, that's on me, ultimately. With an aged parent, so one day, Annie and I may have that kind of a decision to make for you and Mom. Would an advance directive be necessary, or should we have had those conversations and know how to make that decision in line with what you expect and want. Because there is going to be a matter of judgment. Someone has to decide if it's a matter of quality of life or hope of recovery. Who makes the decision on whether that, how far that hope is existent?
And what is dignity and what is quality of life?
Sure.
and-
Who makes those decisions? I would submit that that's the responsibility of family primarily in some way or another. In the absence of that, if they're unavailable or for someone who's a loner, that's where an advanced directive really does make sense, because why would we trust an AMA doctor that we've never met to make that decision for us?
Or a state bureaucrat.
Or a state bureaucrat who, yeah, that's when I think the advanced directives are very legitimate and necessary. When there was family present, though, to make that judgment, perhaps it's better a conversation among family.
But then I think Conrad's question still remains.
Right.
I mean, now you're still right back to, if you're gonna say on one side, abortion is always wrong because it's life that matters, then how can you say, well, look, I know they're 95, but it's life?
Well,
I mean, it's a valid question,
And you start to get to the question of what is life.
right?
There's people who are in a coma, can be in a coma and breathe, and if you're feeding them with a feeding tube and giving them hydration, that they're alive. People who are brain dead, whose brains will not allow them to breathe, are they alive? Are you keeping them alive? You know, there's a different, it's kind of a different question about what is life? And where can you pull that plug? And now we get back to hope of recovery, possibilities of recovery. Oh, that hurt. What is alive? What is life?
But then there's always those stories of people who wake up after years and years.
Yeah, in the mortuary. Yeah.
Yeah.
is it reasonable to submit that life is not found in the physical body? I mean, we have this Greek word sozo. It is life, but it also has this idea of spirit.
Body apart from the spirit is dead, right? That's James.
Right, and so if that has left, even though the body may be mechanically functioning, I don't know that by itself constitutes life.
I don't know.
See, I used to answer these with a market argument that, you know what? It's wrong to expect someone else to keep a member of my family alive to pay for it. It's my responsibility to pay for it, but if I run out of money, I run out of money, and they're going to die. You know, like, these machines cost a lot of money, and so I've made the market argument. Like, okay, I don't have the money, you're going to die. I mean, this is the way the world works, right? And that could be from the very beginning too. I have cancer. Do I have the money for the best doctors? You know, or not? So we made the market argument, but I don't think that answers everything, because that utilitarian argument is going to keep coming back. Did I get a second job to keep them alive? Did I start a crowdfunding Facebook page? I could have done that, and I didn't do it.
Right,
So-
heroic measures or extraordinary measures all of a sudden become a dollars and cents question.
Right, right,
And not a medical issue.
right.
It's,
And again, it comes back to the question of who has the right responsibility and the qualification to make those decisions when you're incapacitated. I would argue that should be family, not medical professionals.
right, but there's also we do operate in a state that has legal arguments for and against family, what's extended family, what's family, right?
I mean, I think I agree with where most of that, but you still have scenarios where parents are sinful and don't want this, and they're saying, don't cure her, let her die.
Yeah.
And then you still have a question of, do I really follow that parent's suicide wish on their or murder wish on their child? You have scenarios like that, so
Yeah.
when is it okay to overrule that family?
That's a really tough question.
And that's one we want to try to look at next week, actually, is parental decisions, because that's a whole nother ballgame.
There's so much here. And
It's
this-
themed like 8 times to overrule. You may not murder, you may not abort.
Certainly. I would think so.
Even if you want to, you're not gonna do it.
That's where church court comes into place.
Good.
Maybe.
But I mean, so how, so then how do you
I
still
mean,
answer
honestly.
Conrad's question though?
Oh, I don't
Because
know.
he's gonna say like, look, okay, you're saying you can't abort because it's life, but then how are you gonna
Yeah.
say that it's okay to pull the plug on a 95-year-old
Right.
person? On the argument that their quality of life will be horrible. That may be
Right.
true, but are you making this narrative? Because again, you even gotta be careful of the backlash and the return strike you could get in the eye with saying, well, hold on, if life is only a spiritual thing, how can you prove the spirit's in the body of an unborn baby?
Right, yeah.
How do you prove that?
Yeah.
And is that not then still just a judgment call?
Yeah.
And we're right back into.
I think that would be a
it's still-
little bit of a utilitarian.
Well, and that's the problem with this question.
Yeah,
That was your question, was DNRs and stuff like
DNR is
that.
one of the, yep.
Is it wrong to have them?
It's a great question.
A what?
A
Is it wrong to
DNR,
have
do not
resuscitate?
resuscitate.
Do not resuscitate. Is that wrong?
Well, here's the thing too, we have not even dealt with, Ryan brought up a little bit, the ethical question. Is a, let's say a parent, a godly parent who's taking care of themselves, take care of you, the same as a drunken parent who abused their body and everybody else the whole time? And now they're experiencing the results of their wicked decisions, and now I'm the child, and I'm gonna keep them alive after their whole lives, they really didn't give a rip? Is that the same?
So it becomes a matter of justice.
That's a legitimate question.
Because,
That's a legitimate question.
Doesn't know what?
Yeah.
Yeah.
Wait, wait, wait.
But I mean, do I have a responsibility as a child to work harder at keeping them alive than they did themselves? Do I have that responsibility?
Do we have a responsibility to prolong the dying process? Is a different question than, do we have a responsibility to prolong life?
But we have to realize we don't actually have the ability, the power to prolong life. It is given and taken by the Lord in His time, and nothing we actually do increases or decreases it outside of His plan.
The
So,
sovereignty of that.
Yeah, I don't know that we can deny God's sovereignty in all of this in any case, but there is still a responsibility to not go so far to test God. And where that line is, I don't know. But
It's-
to
see,
to
this-
say,
yeah.
I've got a little cut that I can treat, but I'm not going to because I trust God, well, that would be foolish,
is there Christian liberty in this whole thing?
perhaps.
Well,
Yeah, but it
if there is,
doesn't
it's too scary.
Yeah, well, I was gonna say, I'm sure there's Christian liberty, I would never question that, but does that change responsibility? Like, Christian liberty individually, sure. Responsibility to one's neighbor, that's still in play, and that does bring up the ethical question. Look, is anybody here gonna actually say that you would have argued for the prolonging of, let's use an extreme example, and let's just grab our old buddy Adolf. Let's say old Adolf gets pneumonia or has some sort of problem and goes into a coma. Are we actually gonna argue, we should, because it's life, we should keep him alive? Because I'm saying pull the plug all day long. He's a wicked, God blaspheming man. Pull the plug.
Because we were
That
trying
may-
to kill him to start with, so why would we try to heal him?
But that's what I'm, but that's the ethical question.
I was praying for
What's
it.
the
You
difference?
prayed for it.
We do that in prison, and we do that in prison now.
What's the difference now? So now
That's not a biblical system.
Like, if we actually had Reconstructionist doctors.
Right.
Who would know what it is, and a church court who would oversee that, then we would be
But
okay.
until we do, we still have to wrestle with these, because at the end of the day, we still have to ask the question, what's the difference between Hitler and me?
Can,
Well, see, that's
Nothing else
the,
in
There is a
Christ.
difference.
Nothing
There's
other than
absolutely a
Christ.
difference.
But only because of Christ.
Got that right.
But that's what I'm
But
saying.
there's still a difference. Even outside of Christ, there's a difference. If you are not committing a crime worthy, according to God's law of death, then you
Understood.
you
Yeah, and
are
that's-
different than the guy who is.
You could also argue that it depends whether any court has made a ruling on it yet. Like, if he's on death row, that's different than if he's waiting trial.
Right,
Yeah,
Like,
See, the dark angle of Conrad's question is the problem here.
Yeah.
Because we want to take utilitarianism out of it, and we're having a hard time doing it.
We are.
Well, it also seems that we are looking for hard, fast rules when I'm not so sure that there are. Scripture tells us that the spiritual man judges
Right.
everything, and so I think there is going to be a matter of judgment in this, and a great deal of this question is going to be who gets to make that judgment. And I don't know that that's going to be the same for every person, every family.
For some of us, though, the problem is that opens the back door to the abortion thing. That's the problem.
It certainly does.
Yeah.
It certainly
And
does.
Dan's point of sovereignty certainly needs to be very much in focus in that, look, we could say, John could have said, yeah, I'm gonna do all the treatments available to me and die a week from now. Like,
Or absolutely none of them, and live for another 30 years.
there, yeah, Dan.
It,
Yeah, I forgot what I was gonna say.
Hand up,
Dementia.
That was a minute ago, and I kept on talking.
All the blood ran out of his brain. I don't have an answer here. I wanted to bring this up. I wanted to beat it up. You
What
know,
was the original question?
the original
The
question
original question.
is the ethical considerations of refusing treatment was the original question. It's how we got into here. Is, you know, and what do you have to take into consideration to refuse treatment?
Was there a subtopic or a second question in that? Or did everything stem off of that one so
I think
far?
it's all off that question.
But it all,
Don't refuse treatment.
yeah, it all started from that question.
Didn't even helmet.
And then there was there's the issues of a reasonable, it's almost like just war theory. Do you have a reasonable prospect of success? You don't go into war, you don't engage in war if you don't have a reasonable prospect of success. You sue for peace. Or, you know, is there a reasonable prospect for a cure or not? And that's kind of it, you know, what.
But there's a different definition of success to different people. Some it might be a cure, some might be another 6 months, some might be
Right, what is
comfort
prolonged?
for the next week, some.
That's right. Is palliative care it, or, right, and that's when we start to get into the judgments of how do we judge?
And I don't like the judgments.
well,
I don't like it.
judgments carry with a great responsibility
Yeah.
that we don't really want, but I think are given to us anyway.
Well, would we all agree, I mean, so would we all agree that it is a lot easier when we ourselves are the ones making the judgment for ourselves?
Right.
That is something we can all obviously do. I think the real questions become, once we are no longer in a capacity to make those decisions, now
That's
what?
the DNR and the advanced directives. I think, for me, when you have your capacity about you, you seek godly counsel. You seek all the information that you can get in order to make the judgment. And then ultimately, you're responsible to make that judgment. I think that it's our responsibility, if we are involved in an advanced directive, you're going to be on one side of that or the other. You're making the advanced directive for yourself, and you've done the same thing that I just said. While you still had your capacity, you sought godly counsel, you sought all the remedies, you made your judgment, and you make your call and make your wishes known. If you're on the other side of that, you're part of the godly counsel that says, wait, I now have a responsibility to also look into these things and counsel whoever it is that's giving me this directive. That's kind of where I've landed, but I'm not saying that's the answer. I wanted us all to consider it. You know,
I'm glad we did this, because there's a lot of men's groups or churches don't really come near just talking about it. I mean, at least we're talking about it.
It's kind of a fearful subject.
It is, but
Yeah.
right, and, you know, I've had to face this over the past couple of years. with God's help, I haven't had any sleepless nights about it.
But it still makes some difference to you after you've studied what you believe is gonna be the best course for your own health. It's like, I believe, I don't know for sure, this is gonna really help, and I believe this may help. If you flip the question and say, I firmly believe this radiation is gonna cause discomfort, but it's gonna cure me. That is my total belief. That's the only thing that's gonna save me. I think it would be a lot more of a straightforward answer. Do I endure the discomfort for the rest of my life to save me now? Is different than, I don't really know if they even know, and we don't know for sure if this is even happening. Do I take that risk? You know, in a very personal level, I mean, that's a much different scenario than I know I have an infection in my toe and it's about to spread. I mean, it's just a very easy, very, you know what's happening. It's just it's something that's happened too often.
Common knowledge issue.
Common knowledge, yeah. It's
Now,
just,
that also brings up the side effects issue with treatments that there's not a ton of confidence in.
right.
So there's a lot of things, we don't know if it works. We think it works for a depression or whatever, but it also could cause depression, so we have to weigh the risks
Right.
versus the confidence level in a treatment.
Right, we just got them describing the problem with the ABVD chemo that I went through. The B can cause, and in my case did cause, breathing disability. But with that said, the ABVD chemotherapy for Hodgkin's lymphoma has cure rates in the 90% range. So it was a no-brainer. Despite, I got a lot of counsel, oh no, never ever go through chemotherapy because of, it's gonna tear you up. Well, it was ugly, it was discomfort. But I don't have Hodgkin's lymphoma and there's no prospect really of it returning.
It worked.
It worked.
Praise the Lord. I think we're all operating on a presupposition that we want to improve life. The improving of life is our goal. And like you said, we need to judge all things, but we need to, as Christians, we need to judge everything according to Scripture. And it seems like we're struggling to come up with any type of Scripture that is contrary to aiding someone in improving their life. I mean, do we have anything that any verse of any type that would be contrary to that?
I don't have a verse that would be contrary to that. The last enemy that to be destroyed is death. It says in 1 Corinthians, right? Chapter 15. So if death is the enemy, and it's named the enemy, we may have a responsibility to fight it at every turn. Maybe. But I don't believe we have a responsibility to prolong the dying process
Right, because it's
But
also a point.
out of hand.
Paul tells Timothy to drink a little bit of wine for his stomach problem.
Yes.
So gathering from that, it is okay to take something
Yeah.
that will alleviate symptoms per se.
Absolutely. There are verses to say, go to the doctor. We read the one,
Yeah, from Luke.
right. There's, in Ezekiel, it's, the weak you have not strengthened, nor have you healed those who were sick, nor bound up the broken, nor we just read this a couple, 2 weeks ago.
It talked about.
There are
Things not
things,
bound up.
it's over and over, it says, you should attempt to heal the sick. We pray for the sick. We bring, if I'm sick, I should go to my elders and ask them to pray for me. We should seek
Again,
healing.
I think a lot of that comes back to Christian liberty as far as Conrad's issue. I'm not sure where that ends up at. Because ultimately, I have to be the one that has to, like you said, I have to be the one that's going to choose for my own health.
What if this particular person is one that you've just been praying the imprecatory psalms about?
If you consider it answered prayer.
Really,
it's
that
a
is
matter
a
of
different
justice.
story. If you believe that they are completely haters of God or
Yeah,
Does
that
that
is not
change
carrying out his
things?
own justice.
Yeah, but, I mean,
But you're not
But you're
responsible
still-
for that person's health.
But what
in
if
the
you,
sense
what
of-
if you become responsible?
In what way? I mean,
Like you were the doctor, you
Like-
mean?
oh,
there's a famous story of, I think it was Menno Simons, who was in jail, he got out of jail, and he, the jailer or whatever came after him to catch him, and broke through the ice, and he pulled him out, even though he knew that meant he was gonna be taken back to jail. I don't know if he was martyred then or not, but, anyway. Well, that's, in by a lot of people, that's hailed as a very commendable thing, like he showed love to someone who was trying to kill him. But you're saying, let the guy die.
That's a question. I mean, honestly, I think I may consider that option, and keep on running and believe that was a
Yeah.
blessing from God.
Why not?
Thank you for
Yeah.
safe delivery.
Delivery from.
Providence.
But I think we have to recognize the difference between protecting ourselves versus protecting someone else. I mean, when the Bible calls us to protect the innocent and the weak, I'm not
That
sure.
guy's
Huh?
That guy's neither. Not innocent or weak.
And so he's to be left on his own.
But we are still supposed to love our enemies, do good to them,
We're also
persecute.
to pursue justice.
But what I'm saying is, individually, as you, he is persecuting you. Are you saying that at that point, you're being persecuted for your faith, you end up in jail because they have bigger guns? When you get out, you at that point start waging war against them because of the injustice that was done to you, or what, how's that work?
I'm not sure.
You get put in jail because of persecution, right?
Right? I feel like that one's going way up.
Yeah, I think I don't think that's.
Okay.
I don't think that's what he's saying.
That's a,
We're not talking about waging war, I think much as we're talking about, do you pull the guy out of the ice or not? And I think.
if you're a doctor, you heal your enemy.
Right.
You're being persecuted by a guy because you're Christian. Now, he gets sick and he ends up on your operating table.
Right.
Do you heal him or do you let him die on the table?
Right, it's just about.
That's kind of your,
Do you try to stop the bleeding on a guy you just shot?
Yeah, during the war between the states,
That's just
the
it.
doctors got all kinds of credit for trying to heal people when the others fought against them. They got all kinds of credit for that.
Which kingdom is it about, though? I think that's the question. Am I not doing it because you offended me? Or am I not doing it because you hate Christ? Let your enemies be my enemies.
You see,
Let me hate
this-
them with a purpose.
There's also a famous story,
in that.
Vladimir Lenin almost drowned when he was a young man. No one knew how rotten he was,
Right,
and he was saved by someone.
right. Is it good or bad for his neighbor?
Right. Do you save this guy at the end of his life after he killed millions of people?
Who knows what might happen if you show love to an enemy? Perhaps he'll become your greatest
you don't know.
friend.
Don't know. You don't know.
It's true.
All right, I'm sorry, we went way over here, but I thank you for the,
And you don't have, like, all the answers?
Are we any closer?
We're not.
I'll email the answers.
We're not any closer.
No, we're not, and we're not gonna get real close to the answer next week when we try to talk about the kids and the decisions that we have to make as parents for our children. Because that now we have not only legal responsibility, we have biblical responsibility under both civil law and biblical law for our children, we do. And so,
Unfortunately, those don't often line up.
they don't, and they do,
In concept they do, but in specifics they often don't.
often don't, that's correct. And where does that line get crossed, and we'll try to talk about that next week. So, I thank you for the discussion, it was helpful to me, I hope it was helpful to you guys.
To Seth's point, I guess it's a good thing we even have to do this now. A few years ago, you didn't even have these discussions because the state of medicine was not able to even help you here.
It actually brings up a question, let's look down the road future. and say, suppose that you could take a pill that would extend your life to 500 years. Do you take the pill?
What's the cost?
Suppose you're going to be healthy for 500 years.
It's covered on insurance, it's free.
You know, that's a dilemma. That's just medicine.
Well, maybe, you know, that verse about men will live to 120 and it will just be norm?
Yes.
Maybe that pill is the.
That's
the
exactly
answer.
what I'm talking about.
Maybe that pill
Because-
is
Because
the means to that.
that section of Isaiah is, I believe, talking about the world that we are going to make as Reconstructionists. As theonomists, we believe that things are going to get better and better and better, and I expect that pill. I expect that longevity.
Or, yeah, or even without the pill.
Or something, yeah, something
Right,
like it, yeah.
right.
Only half of our life is gone now.
Yeah. Well, I mean, it's a really specific statement. It's saying that the one who dies at 100 will be considered as dying young.
Right.
It's very specific, the statement in the scripture.
61.
And biblical lifespans,
Yeah.
from before the flood,
Appear to come back.
appear to come back. And that's going to be because of medicine,
Yeah.
because of the grace poured out.
Yeah.
Are we, you know,
It's God's grace that we need to have this discussion even right now.
of course.
Well, yeah, we're not any closer, at least I'm not.
I see
I'm
what you're
not-
saying about
I'm not.
the back door to
But thanks
abortion,
for
because
engaging.
If the pro-lifers have to change their signs to most lives are
Right, yeah,
are worth saving, then,
yeah.
most lives are precious, then
Yeah.
it's gonna not sound quite so good.
Yeah, that's right.
Right, political counter move.
Yeah.